This is dealing with pregnancy and fetal development. It is a combination of exercise 44 as well as chapter 28 in the textbook. With pregnancy, obviously this is dealing with all of the events that happen after fertilization has occurred and until the infant is born. Conceptus is developing offspring. The gestation period is roughly 280 days. It's the time from the last menstrual period until birth. The embryo is the term that we use to refer to this developing offspring from fertilization through week 8, and then from week 9 through birth we refer to as a fetus. Part of the reason for the change in the term there is pretty much all of the organs are formed after week 8 and then just grow in size and mature in development, preparing for the birth. But everything is pretty much formed and working after week 8. This diagram shows approximate size from fertilization, 1 week, the 3-week embryo, to the 5-week embryo up to 12 weeks, which is about 90 millimeters in size. This is showing the process from ovulation, from that ovary, the release of the oocyte, how it has to travel from the ovary to the uterine tube. The fimbriae, those finger-like extensions, are moving, create kind of a current to draw it into the fallopian tube. From ovulation, fertilization must occur within 12 to 24 hours. After that, if fertilization has not occurred, that oocyte will begin to break down. So fertilization occurs. The fertilized egg now is referred to as the zygote. It starts mitosis right away. It goes to a 4-cell stage. We refer to then a morella in about 3 days. As you can see, multiple cells have continued to be formed as it goes through mitosis. It develops in size, increasing cell numbers as it continues to travel through the uterine tube down towards the uterus. After about 4 days, what we call the blastocyte at this point has entered into the uterus and must implant on the uterine wall. This will occur usually in a couple days after entering the uterus. The endometrium has been prepared for the implantation to occur. So that blastocyte, as I said, will float around for a few days. It's nourished by the uterine secretions, and after about 6 to 7 days after ovulation, implantation actually begins. The cells will start to adhere to proper receptors, and chemical signals of the endometrium will help to make it more permeable so it can attach. So here you see the endometrium, the uterine endometrial epithelial cells there, where the trophoplasts, this beginning cells, it's like a vesicle, and the internal part has the internal cell mass that have been going through mitosis that will attach to the uterine wall. Now, when implantation occurs, it's about day 26 after the menstrual cycle. The corpus luteum, remember, that was the remains of the follicle in the ovary, and it has been secreting hormones that will help prevent menstruation from occurring. One of the main hormones that it produces is human chronogonadotropin, or the HCG. This is going to be secreted by the trophoblast cells. This is helping stimulate the corpus luteum to continue secretion of progesterone and estrogen, once again preventing basically menstruation from occurring. You're trying to prepare that uterus for the implantation to occur and to maintain it. Now, a lot of people think that the Placenta is involved with all of the release of hormones to maintain the pregnancy, but the placenta is not initially formed. It's not formed until about month 3. So the HCG levels will rise very high through the first 2 months, and then it will start to decrease. When it starts to decrease, this is about the time then that the placenta has taken over essentially for the corpus luteum and starts to secrete the estrogen and progesterone. Now, initially the levels are low that are being produced by the placenta, but it will increase throughout the rest of the pregnancy as that placenta takes over the secretion of these hormones. If implantation fails to occur, then basically the uterus is not receptive, and essentially what happens is what we call spontaneous abortion. The developing zygote will not be able to implant, and it is released. It's estimated that of those zygotes that implantation does occur, about 30% of them probably are going to miscarry. Why does this happen? It may be due to genetic defects of the embryo. It may be due to some defect with the uterine. It's not, the endometrial layer is not formed properly, or there may be no reason whatsoever that you can detect initially why this has happened. Oftentimes, because this is happening within the first week and a half that fertilization has occurred, the woman doesn't even realize that she is pregnant. This graph is showing in orange the HCG. This is the hormone that's tested in pregnancy tests. So you can see there's initially a very high peak, but then it decreases after the second month. And then you have the increase. The blue is estrogen, the green is progesterone, which is now being secreted by the placenta to maintain the pregnancy. The formation of the placenta is going to originate from both the embryonic and the maternal tissues. The placenta is usually fully formed and functional by the end of month 3. It's going to help provide the nutrition, the endocrine functions, the gas exchange, etc., between the mother and the developing embryo. Keep in mind, however, that the blood supply from the mother and from the embryo do not mix. There is a placental barrier that prevents the mixing of the blood. Now, things from the maternal mother can pass. From her blood, there are some, obviously, nutrients can pass. Unfortunately, some microorganisms can pass and cause infection, which is a concern. Some proteins can pass, but there's actually no mixing of the blood itself. If the hormones being produced by the placenta are inadequate, not enough is being produced, the pregnancy is going to be aborted. Now, during implantation, the blastocyst, that's what we refer to, that group of cells, that's going to be converted in what we call the gastrula. There's going to be 3 different, what we call germ layers, that will develop ultimately into producing all of the organs and systems of in the developing embryo. The inner cell mass is going to divide into 2 layers, and then there's a subdivided inner mass that's referred to as the embryonic disc. There are membranes that are formed during the first 2 to 3 weeks. This is going to include the amnion. These cells will form the sac that is going to be filled with the amniotic fluid that helps to surround the developing embryo. This is what you often refer to as the bag of water. It helps to protect that developing embryo. It keeps it in a very stable, buoyant type of environment. It maintains temperature. It does allow for movement. Initially, the fluid comes from the maternal blood. Later in the pregnancy, the developing fetus is actually producing urine, and that's going to also contribute to the volume of this amniotic fluid. Of these extraembryonic membranes that are formed, there's the yolk sac. This ends up forming part of the digestive tube. Very early on, it's producing blood cells and forming some of the blood vessels. The allantosis is going to be the structural base for the umbilical cord, and it becomes part of the urinary bladder. And then the chorion helps to form the placenta and form most of the other membranes. So this is showing the implantation of a blastocyst that's about 7 days old. After about 12 days, you can see the blastocyst that the implantation is now complete. It is completely embedded within the endometrium. And then by 16 days, once again, the embryo is now starting to show the 3 different germ layers. You can see the yolk sac, the allantosis, which, as I said, is going to form the umbilical cord. At 4.5 weeks, you can see the embryo. You once again can see the extensive blood supply. Excuse me, both the embryonic blood supply and the maternal. But once again, there is no mixing of it. The embryo is receiving nourishment via the blood vessels that are embedded in the umbilical cord. These are referred to as umbilical vessels. It is connected to the placenta. As you can see here, the developing embryo with the placenta, with the blood supply, and the placement around the endometrium within the nucleus. Oh, excuse me, within the uterus. Obviously, there's quite an extensive blood supply because the developing embryo is dependent upon the mother, and so the growing tissue is very actively growing, going through mitosis. It needs to have a lot of nutrients, a lot of oxygen, and it's developing waste products that it must get rid of. So it's dependent upon the mother's supply for that. If you look at the lower right picture, you can see forming in the umbilical cord are the blood vessels. There is actually 1 vein and 2 arteries. So there's 3 different vessels that are contributing to supplying from the mother to the developing fetus all the nutrients, gas, and getting rid of waste. Gastrulation is occurring during week 3. Everything is relative to when fertilization occurred. And this, as I said, is when you start to form 3 different germ layers: the ectoderm, the mesoderm, and the endoderm. These 3 layers are very primitive forms of tissue. Ultimately, all of the body organs will be formed from them. The ectoderm is going to become the nervous system and the epidermis of the skin. The epithelial cells are found there. The endoderm becomes linings of the digestive, the respiratory, the urogenital systems, and the glands that are associated with them. Everything else is derived from the mesenchyme. Organogenesis is the process of forming those body organs and the systems. As I mentioned earlier, by week 8, the embryo is roughly about 1 inch long. All of the organ systems are now recognizable. This is a 5-week embryo. As you can see, some of the organs are starting to form. Some of the glands, such as like the thyroid gland, The lungs are forming, the stomach, pancreas, liver, etc. If we look over the following table that shows progressively the development events in the fetus at 8 weeks, which is the end of the embryonic period, you'll notice that proportionally the head is very large. This, as the development continues, proportion-wise will change. The liver appears very large. It's actually starting to form blood cells. You do have the first brain waves that can be detected. The limbs are present. Ossification, the bones has begun. There is some spontaneous muscle contractions that are occurring. The cardiovascular system is functional. The heart usually starts pumping around between week 3 and week 4. So all the body systems are present. That's why now we changed the terminology from embryo to fetus. In month 3, the head is still large, but the rest of the body is starting to elongate, so proportionally is starting to catch up, if you will. The brain's continuing to enlarge. The retina, the eye is present. Facial features in very crude form are present. You can determine the sex. Week 4, the sensory organs are differentiated. You see blinking of the eyes, sucking motion. Glands are developing in the GI tract. Most of the bones are now pretty much distinct. You can tell where the joint cavities are in month 5. Now what is happening is the limbs are reaching kind of they're pretty much near final proportion, not size but proportions. The developing fetus tends to move into the fetal position where it's bent or flexed forward. That's because of space restrictions. Usually the mother now at this time has been able to feel movement. In months 6 and 7, there's a lot of increase in weight. Myelination of the spinal cord is beginning. The skin's kind of wrinkled and would be red. Toenails, fingernails are present. Bone marrow is making blood cells. In males, in the 7th month, this is when the testes should descend down into the scrotum area. If premature birth occurs at this point in time, the survival rates over the past several years have increased dramatically. Now, there are things that you would need to be certainly aware of, that the lung are not completely formed as far as the surfactant, and so you'll need to be careful with the breathing of the preemie, may need assistance. The other thing you would certainly have to watch is the hypothalamus, which controls temperature, has not quite been fully functional yet, and so you would need to watch certainly the temperature. In months 8 and 9, fat is being laid down in the hypodermis area. You continue to have rapid weight gain at this time. In terms of the mother and development that occurs during the pregnancy, you can see in A, the size of the uterus before conception has occurred. The uterus is about the size of a fist, and it's definitely in the pelvic cavity. At 4 months of the pregnancy, you can see that certainly that the uterus is having to increase in size to be able to accommodate the developing increased size of the fetus. By 7 months, the fundus, the top of the uterus there, is above her umbilicus. And by 9 months, the fundus typically has reached the xiphoid process. The human placental lactogen hormone is going to stimulate maturation of the breast, fetal growth, glucose sparing in mother, meaning uh, the developing fetus gets what it wants first. Mom is second. This can often lead to gestational diabetes in the mother. Parathyroid hormone and vitamin D levels are going to stay pretty high throughout the pregnancy so that the fetus and developing gets enough calcium for like bone mineralization, ossification that is occurring. So these are all some changes that will occur metabolically in the mother. In terms of physiological changes with the GI system, morning sickness is often a problem for some women. There have been studies that have linked morning sickness to elevated levels of the HCG. May also be associated with elevated levels of estrogen and progesterone. Heartburn, constipation may be common problems with the urinary system. Because the developing fetus is producing waste and the mother has increased metabolism to provide more nutrients for the developing fetus, she also has increased waste, so this increases urine production. Frequent urination may occur, especially later in the pregnancy, as remember the uterus is on top of the urinary bladder. So as the developing fetus is getting larger in size and the uterus is increasing in size to accommodate the fetus, that's all pressing down on the bladder. So as I always say, if a woman is pregnant and there's a line for the restrooms, let her go first. Please be nice. The respiratory system. The increased levels of estrogen often cause congestion in the pregnant woman. She may also have issues with more difficult labor breathing later in the pregnancy, also because as basically everything's being pushed to leave room for the developing fetus, this can push up against the legs, also can have changes in the tidal volume in the later pregnancy. Cardiovascular system, the blood volume increases. Why is this? Because it's more or less in preparation for childbirth that there is going to be blood loss that will occur. So it's kind of if you increase the volume and then you lose some during childbirth, you're back to what the normal volume should be. There may be issues with developing varicose veins in pregnancy because there may be less efficiency in returning the blood from the lower limbs back up to the heart. Certain clinical applications, there are different factors that can cause abnormalities, congenital abnormalities in the developing fetus may actually even lead to death of the fetus. These are referred to as teratogens. These basically some substances that can cross that placental barrier. Women who are pregnant are advised not to consume alcohol because when they do, the alcohol can cross the placental barrier and actually cause the fetus to become affected. But the results are much longer lasting in the fetus and that may be born with fetal alcohol syndrome. It can affect the growth and have long-term effects overall in development of the child after birth. Nicotine can interfere with the delivery of oxygen to the developing fetus, and that then will impair the growth and development. So a lot of drugs can cross the placental barrier as well as some microorganisms. Preeclampsia, this is a complication of pregnancy that some women have where it can lead to deterioration of the placenta and where it ends up having insufficient blood supply, therefore not supplying the developing fetus with enough nutrients or enough oxygen. Usually what will happen with preeclampsia, the woman becomes hypertensive, which is high blood pressure. She may have swelling. This does affect about 1 in 10 of pregnant women. We can estimate when the birth date's going to be by when the last menstrual period was, and then by measurements taken, especially late in pregnancy, where that fundus is. However, the fetus determines when it wants to arrive. It doesn't care what anybody else wants. In the very last few weeks of the pregnancy, estrogen levels will reach their highest levels, and this is going to have an effect. Basically, the fetus also is helping to stimulate the placenta to secrete even more estrogen. So as we see here, what's going to happen then to induce labor? You've got the increased production of estrogen. This high level of estrogen now from the placenta is also going to now induce oxytocin receptors on the uterus. What does oxytocin do? It's going to, when it starts to be secreted from the fetus and also from the mom, so oxytocin is being released from both places. This oxytocin stimulates the uterus to contract. It is also going to help stimulate the placenta to release additional hormones, prostaglandins, which in turn will then stimulate the placenta to release more prostaglandins. It is also going to stimulate the release of more oxytocin. It's a positive feedback. So as you release these two hormones, they stimulate the uterus to contract. They stimulate the placenta to release even more, which is going to then stimulate even more contractions. And so that's why the contractions will progress quicker and stronger until birth occurs. The neonatal period is the 4-week period after birth. The birth is a shock to the baby, so there are going to be some assessments that need to be done immediately after birth. These are referred to as the APGAR score. There's a scoring system that is given for heart rate, muscle tone, respiration, reflexes, and color. If that score is between 8 and 10, that means it's a very healthy baby. So we use that to as a guide for evaluating the overall health of the newborn.